project. And the National Association of School Psychologists is one of those many associations that are involved in that. But that policy really provides great guidance and practices for school districts to follow in order to protect the health and safety of students. Since suicide really was the second leading cause of death among youth, ages 10 through 19. And many districts have used the model policy to help craft their individual district or state policies. And as an example, one of the districts that we work with is Hillsborough County School District. They've created their own suicide prevention protocol and manual for administrators to guide that work. If it's really important to have these kinds of policies adopted and in place and documents to really make sure that it drives the focus of the work in our schools and really help support our students. If you want examples of these documents, reach out to Kyle Bishop in the chat box or email him so that he can get copies of those to you. Training is really important. And as you saw in the laws, training is a component that you see happening in many of the states that have enacted laws. And when you think of training, there are key areas of practice that staff need to be trained in. One is in prevention, obviously, or how schools can promote resiliency and help reduce youth suicide. Another one is in the area of intervention. How can school staff intervene with the students who are at risk of self-harm or suicidal behavior? And third is, how do you follow up with interventions for the concern? In other words, what do they need in school? What might they need outside of school in the community and at home? And what needs to be in place when they return back, to school to make sure that things are safe and handled appropriately for students. In crafting your policies and implementing procedures and practices, it's also important to be familiar with civil commitment laws and standards, since these vary across states. And generally, there are three forms of involuntary treatment authorized by civil commitment laws. And one of them is emergency hospitalizations for evaluation. In essence, that someone is committed, for an evaluation, so that can happen on an emergency basis. There's inpatient civil commitment and there's outpatient civil commitment. And really the core criterion for justifying this is really a mental illness that results in a danger to self or others. But again, it's important to know what is happening in your state, what's in place at your state, and kind of align that, because you might have to report as a district a key performance indicator in that area. As an example, in Florida, we have the Baker Act, which is really a law for involuntary commitment. And that Baker Act data is highly tracked, reported, and very public. And so it's really important for districts in their processes to include, an element to capture that information. So let's move to best practice number 2, and that is to use evidence-based suicide risk assessment tools. And when we think of, these tools, they're tools that are used by school personnel and non-school-based mental health professionals to identify suicide attempt and also assess the nature and extent of suicidal ideation and behaviors. And frequently or commonly used in schools, you see some instruments that are cited. For example, safety is one of those. The Columbia Suicide Severity Rating Scales is another. The Ask Suicide Screening Questions is another example. I highlighted the Columbia, because it is one that when you frequently speak to school districts and or mental health professionals in schools, they're very familiar with and are using that one. The third one, Ask Suicide Risk Questions, generally is used in more clinical hospital type or medical type settings. A little more about the Columbia itself, and that screening instrument or risk assessment instrument. It was developed in 2009. It is adopted by the Center for Disease Control. It is been demonstrated to show successful suicide attempt predictions, and it is listed as the only screening tools Okay, is somebody taking over my screen?
Yeah, it looks like we lost your screen, Will.
Yep, I don't know what happened. Hold on one second. I'm back there again. All right, that was strange.
Thank you.
Okay, thank you so much, though. So anyway, as I was stating, it has a full range of criteria that is utilized, and it's also on the National Registry of Evidence-Based Practices that list screening instruments. There are many types of tools listed in that registry. So if you want more information on, what evidence-based tools are out there for risk assessments, please go ahead and send a note to Kyle in the chat box, and he will go ahead and get you that information. And then we have best practice number 3, which is provide students identified at risk with interventions and supports. And these interventions, need to be in school and community-based, if appropriate. Why are interventions needed? Why do they need to be implemented? Because suicide is such an alarming area right now with everything that has been happening with mental health and well-being of our students in our schools. And some of these facts kind of point to the need for why we need to have interventions available and in place for our students. We lose more students to suicide than we do to mass shootings. When you think of threats, there are more threats to self that outnumber threat to others or even threats to schools. When you look at CDC data, the number of children who took their lives doubled in a 10-year period. When you think of the context of what is happening now in our nation, Black youth suicide rates are rising faster than those of white youth. And when you think of coronavirus, police violence, all of this kind of deepen trauma for children and subgroups of children. And the National Youth Behavior and Risk Survey, which is a standardized survey that's taken across youth across the nation, has shown a 10-year trend of rising suicide attempts, sadness, and hopelessness among America's youth. And we know in our schools that many of our students who are contemplating suicide exhibit warning signs. It's important to be vigilant, to look for, hear, see, report, and take action. School-based mental health professionals, whether they be in our schools or out in the community, really play an important, vital role in identifying the students who are at risks. I mentioned previously the National Youth Risk Behavior Intake Survey, and I wanted to highlight that that survey, when you look at national data, 5 of the 4 key performance indicators that are tracked through that survey and student responses really are showing that it is increasing. So it's alarming to see the increases that are happening in particular areas. And in one of those, it's pretty much flat. It's not increasing, not decreasing. So overall, the data is alarming, and it requires action and vigilance in our schools to address these needs. We've all been living through COVID-19. We've moved to new phases, and we are now also experiencing other areas of stressors, in our lives, and our children are impacted by these. And some of them are academic stressors, they're family and economic stressors. That's the social isolation that has been taking place. We're in a new reality there. And there's actually anxiety itself about, COVID-19 and, the impact that it has on children. And, when we think of stressors, we realize they affect everyone, including children, and how they feel, think, and act. And when they're experiencing bad things, like we're experiencing now, there's lots of things that are coming our way that are impacting our feelings. Children may have many different thoughts and feelings. The bad things that are happening can affect how they cope with these stressors every day. And they may experience feelings in their bodies have unusual thoughts coming through and act differently. And we need to kind of be vigilant at home as a parent, from the school setting, professionals interacting with families and children, and looking for these signs to really know that we need to start looking at a way to address these when they come up. So at this point, I'd like to stop for a second and just pause. We covered 3 particular areas: suicide prevention assessment policies. We talked about evidence-based suicide risk assessment tools, and how important it is to look at the signs, the stressors, and providing interventions and supports. Does anybody have any questions, at this point in time?
Hey, Will, yes, I have a couple questions that came across. So the first one is, what are some actions frequently taken to align suicide prevention and risk assessment policies, procedures, and practices together? Do you have kind of a summary of that?
Yeah. I think what happens generally is that either states, school district, or schools look at are there state policies, are there district policies, and if not, how do we align them? That's number one. Number two is, do we need to convene a work group to really look at suicide prevention and risk assessment as a whole, to help with the development of the policies, the development of the procedures that need to be implemented, the tools that go with it, et cetera. And also help develop a suicide prevention plan for students. Those are some of the steps you frequently see taken by either at the state level or at the district level or at the school level in order to craft their policy and procedures and have something in place.
Great. And one more that just came in. Do these best practices translate to the collegiate level, or is this only applicable at the K-12 level?
Well, I think suicide risk applies at all levels, because suicide is something that happens not just in K-12 settings. It does happen at the collegiate level, and it happens in our community.
Thank you. Finally, last one that I just got in. Is there a specific or preferred risk assessment instrument or tool recommended for use in school settings?
As I mentioned, there's a national registry, and that national registry lists a lot of the tools that are available, and it talks about the level of evidence on each one of those tools. In a previous slide, I highlighted that there are some that are commonly used in our schools. Safety and Columbia are 2 examples of those that are frequently used in schools because training is provided and resources sometimes are free. But it really is incumbent on each state, district, and school to really do their research on what would be the best instrument or tool to use for risk assessment based on the context of their community. And many states already have actually recommended certain tools. So it's important to kind of look at what's recommended in your state and align to that.
Kyle, you had a hand raised with one more question.
Yep. One more just came in. What ages were questioned on the national survey?
That was adolescents, so it's high school students. So that National Youth Risk Behavior Survey is administered to high school students across the nation, and data is published on a yearly basis, and it's a good comparative measure.
Excellent. Thank you.
You're welcome. All right, moving on to best practice number 4. It's really important when we've identified students that are at risk and developed interventions and supports for those students that we develop that safety plan for the students of concern. And when we think of a safety plan, really what it is, it's a brief clinical intervention. It follows a risk assessment. It is hierarchical and supportive, with lists of particular coping strategies and sources of support that may be necessary for that student. It is to be used during or preceding a suicidal crisis. So, it's both a prevention, intervention, kind of approach. And it involves collaboration between the student, the mental health professionals in school or outside in the community, and the parent. But most importantly, it really is another tool in your toolbox to really help provide the support that's necessary for the student upon their return to school. So what does a safety plan generally have? It has many components, and this is an example of some of the components that would be in a safety plan. All of the information gathered about, the event, the details that really around the event, the documentation that needs to be gathered in various areas to review, to really be able to make a determination, the types of questions using a protocol or an instrument or a tool that's evidence-based that guides that decision-making process. And lastly, being able to make a determination based on all that information, if it was unfounded, if it was low in risk or high in risk for a student, and that you have a method to notify parents of what has happened and what action has been taken, and that there's a summary or signatures of all folks that were engaged in that process. This is an example. You see in the bottom there are 8 pages. I'm really showing you 2 of that example plan. Another best practice is really to debrief with the team after each incident. And these incidents are never easy, and very difficult, to handle in our schools and impact everyone, the students, the staff, the families, etc. So when you're debriefing an incident, it's really important to kind of key into some areas in your discussion. The identification and the support of students at risk of suicide, making sure, that who they are, who are these students, how do we best support them in this process in a preventative way. That staff, their level of understanding about what to do, and when they have concerns about a student's safety, that they're well versed in that they know how to handle the processes and where they need to go for this, that there's clear communication within the school with all those engaged in addressing an incident of self-harm, that there's communication with parents along the process in accordance with how you define your policies and procedures, that you support school staff, because it's not an easy thing to deal with, and everybody has a role in being able to address an incident of self-harm so that they feel supported in the process, and most importantly of all, to really support students, because that's what you really want to be able to do. And by debriefing, you learn what you could do differently the next time around, and really calibrate the way you handle these incidents in your schools. Lastly, I'd like to address best practice number 6, which is to evaluate and select technology to help document processes and ensure fidelity and provide student support. When things are paper-driven, sometimes papers get misplaced or do not appear when they're needed, or you don't have the background information on previous incidents or how previous situations were handled. So it's really important to know what is out there that you could use that really helps you in this process. So what are some things to look for in technology when we're thinking about suicide risk assessment? Well, some of those things that we're looking for is, does it help in the determination of the student's suicidal potential? And is it based on a research-based foundation? Is the tool helping with a selection of appropriate interventions? Is it documenting the actions to help mitigate a student's suicide risk? Does it ensure that each student has a safety plan depending on the level of risk determined? Is it capturing the necessary interviews, documentation, information gathered with students or from students, parents, and teachers? Is it providing school and district level reporting and monitoring? And does it notify key parties automatically about what they need to do or what's in process for an incident of self-harm? So, that process is really important. And, when you look at a process, if you look at a process for assessing suicide risk, there are many responsibilities and obligations on behalf of schools. Having these steps and processes embedded in a software solution will keep everyone managing the process with fidelity, and it'll help the district better implement its suicide risk assessment or its threat process. So an example of what a tool should be able to do is and be available to school is that it should have a dashboard that shows the number of risks that are being managed and supported for students, and it gives administrators a quick view on open suicides, finalized threats, open monitoring plans, data at your fingertips that you can get at the district level, at the school level, at the student level. So that's one aspect of what a good tool should have, to help you implement and manage this work. Another thing that it should do is that it should be fluid, intuitive, and the intake process and the creation of a threat assessment process should be well guided. If you look at this, a good risk assessment tool really allows the district to customize, add as needed, and it really allows you to look and see, have you completed, any threat assessments, what's currently there in the history for a particular student, what needs to be completed next that may not have been finalized at any point in time. And, the other thing about a risk assessment is that an intake is that it leads you to an assessment that really addresses a lot of components, and lots of parts from, gathering the information, reviewing all of the records, conducting the screening and the protocol, and, at the end, making the risk determination and having a PDF of a report, not just something in the system, which is an event that you have, it's there for history, but also a PDF that you can pull as necessary. And this is an example of, what a document would look like. And this would be, an intake document, that you would pull, that you would be able to either see or view and or print as needed. And depending on, whether it is a intake or a actual report, then you would have multiple pages of information all there at your fingertips as needed. So with that in mind, those are, some of the things that I wanted to point out, with regards to number 6. And, again, what I wanted to highlight is that it really, a good tool will let you create new threats. It will let you assess threats. It will let you complete reports in the system. It will let you print reports from the system, including safety plans as needed for students. And it really makes everything accessible for users. So I wanted to summarize the points I covered today. And, I wanted to summarize with some reflections and some questions for you to think about. As you've heard, the 6 best practices. Do you have suicide prevention and assessment policies and procedures and require staff training? Do you have evidence-based suicide risk assessment tools that you're using? How are you providing students at risk interventions and supports? Are there safety plans? Are you debriefing? And are you evaluating and selecting available technology to help you with these processes? So I leave you with those thoughts at this point, and I wanted to share that I've been doing a lot of research in this area. And recently, there was a new white paper that has been published, and it is available. If you are interested in the paper that covers a lot of what we're talking about today, go ahead and reach out to Kyle through the chat box, and he will go ahead and get that information to you. So I'd like to turn it over to Rick and Kyle for any questions or reflections.
Great. Thank you so much, Will. I do have one question that came in. Is there a place that we have a kind of a sample safety plan that we could share, or that you could provide to people?
Yes, we have the one that I showed actually was an example. We can probably pull one from one of the ones that we have and send that out to folks.
Excellent. All right.
Okay.
I'm not seeing any other questions, but again, if you do have questions, do you have something, Rick?
Yeah, Kyle, I just wanted to ask everyone if they would just use your raise hand or a yes or no, and just is your district using one or more of the practices Will identified? It would help us to know how helpful we were today, if it highlighted something you are doing or intend to do. If you'd be kind enough just to give us a chat feedback or raise hand that, yes, we're doing one or more of the 6 practices, I think that would be helpful and inform us for the next 5 parts of our forum. And I see a lot of hand raises coming already. 14, very good. 15, good. Thank you. Thank you, Gina. Thank you, Keith. Absolutely great. That gives us great feedback. Jason, thank you for your input. Very good. Very good. It's great to get feedback in this virtual world. Excellent. And Kyle, do we have any other emailed questions? If not, we can open it back up again briefly and then go over the next schedule sessions for the Student Mental Health Forum.
Nothing else has come in yet. I think we're okay to kind of proceed to the next step. Well, Rick?
All right, go ahead and let's pull up the session schedule. And what I'd like to do here, Will, with the balance of time that we have is I'd like to encourage those of you out there to, step forward. We are looking for presenters in the remote crisis intervention. If you have experience in that area, if there's something you would like to share with your peers on the Student Mental Health Forum, would you please do a chat or a hand raise to Kyle, or if you'd like to email Kyle, but just something. We're looking for someone there. We are understanding that's an important topic. And the context around this would be, I've got a crisis with one of my students or my family, and I have to try to manage it over the phone, or I have to try to manage it virtually. So give us a hand raise out there if you know someone that would be a good presenter, or if you yourself would like to present. July 22nd, equity is certainly in mind. We want to think about how, threat assessments, mental health services are provided in that context. We have been talking with some folks there. We need more presenter ideas. We may have someone come forward again from Dallas to share what they're doing in their community, to think through how they're doing that. We're looking for more folks, more ideas. And August 5th, we anticipate a big turnout. How are we addressing the needs of the student? How are we logging the supports and the mental health services that they need? How are we managing that data to help those students and families? So we would love to have your feedback on that session. And Kyle will be forming more invitations and links to those meetings. The invites for July 8, 22, and the 5th have not yet been sent out. If you would like to be on our mail list and you have got this through a friend or through a referral, that's great, but send Kyle a note and we'll make sure we get you added. We have about 1,000 people on our list. for these, so we'd love to add you as well. And Kyle, I'm seeing a lot of hand raises. That's great. A lot of interaction out there in virtual land. We know people care a great deal about this topic. We can't see you, can't shake your hand, but we know that that is where you are just by seeing the interactions come through and people chatting and hand raising. So again, we are PCG. We are supporting the idea of the Forum for Student Mental Health. Our threat assessment and mental health efforts are led by Mr. Dan Wisman, who presented about 2 weeks ago on learning the 3 major protocols of threat assessment. We had 110 people attend that just to learn what the protocols are for managing a threat when that is first learned, coming from a student. And that led birth to the Student Mental Health Forum. So without anything further, Kyle, if there are no other questions, I'd like to thank Dan for his leadership in this area. I'd like to thank each of you for taking your time. We may give you back a few minutes today. This is your forum, so we're here till 2. No question is a bad one. Feel free to submit a question here for a couple of minutes as Kyle sorts through some of the chats. Kyle, back over to you. Anything you're seeing come through? See a question coming in from
one
Celia.
just popped in.
Okay, take that one.
Sure. So who could I reach on behalf of finding more educational based presentations similar to this?
Well, Kyle, that's what we're solving for, is providing good educational based content. As many of you noticed, there's no product demonstrations here today. This is about content, about being helpful. And you're looking at the schedule. What we might ask the person back, Celia, thank you so much, is, ideas for topics. If there's something here that you don't see, maybe this needs to be a 7-part series or an 8 or a 9 or a 10-part series. So here you see the schedule. All these will be very educational based. There will be promotion neutral. These are all about content, learning, sharing, exchanges. These are really peer-to-peer presentations. Thank you for that question, Celia. Kyle, there's another one from Edward Romero. Adding him to the listserv. That's great. That's great.
I certainly will. Yep.
Oklahoma City Public Schools has asked for information. I see several folks asking for the white paper. So absolutely. Anyone else out there? Any other questions before we start to close it up today? All right.
This is Dan Wisman. Just wanted to say that Cecilia, that the white paper that Will is written and authored has many references in it. So we'll get that white paper to you and to anybody else. And there's a big bibliography on that, which will help point you to other materials. So.
Thank you, Dan. Very good. Very good. Will, any more closing remarks? Great comment from Laurel Thompson. Thank you, Laurel. Great presentation. Very
and Rick,
good.
the only thing that I was going to say, Rick, is, obviously this is very complex, layered work in our schools, very sensitive work, but with mental health being such a concern and important area of work. And, for any of the folks on the other side who, deal with the fragility of many of our students, we are very well aware that a suicide would be a very tragic result that we would have to address for any one of our students in school, just like a school shooting would be a very tragic result multiplied many times over. And both of these types of acts are preventable. And, there is such a connection between mental health and incidents that happen in our schools and students, whether they be threats to others, threats to self, which we just talked about today, or even sexual threats, which we deal in and day out. So I just wanted to leave, with parting thoughts that I think everybody has a piece of this work, and we need to work together to prevent these kinds of incidents from occurring, in our schools and address the needs of our students.
Very good, Will. Thank you, Will. And Kyle, we've got Portland Public Schools, Jefferson County in Kentucky. We have Orange County Public Schools, San Diego, Dallas, all requesting white paper and to be notified of the next series of events. So great feedback from each of you. Thank you so much for that. It's great to get feedback again, being in a virtual world, but we know you're out there, and we thank you again. Kyle, if there's no further, let's go ahead and wrap it up. Will, thank you for those closing remarks. Dan, we'll go ahead and close it up. Kyle, anything else?
Nothing else. And thank you, everyone, for your comments. We will get the documents out to everyone who's requested it.
Very good. Great job, Kyle. Thanks, team, and thanks to each of you, and hope to see you on June 17th to hear all about Dallas ISD's mental health reorg. We've got 120 people signed up for that. Same time, 1 week from today, Dallas ISD. Thanks, everyone. Have a good afternoon.